Last speaker before lunch is Mr. Matt Lashey. He's from Chemo Wave. He has a talk about a mobile app that's used for patient experience. The title of his talk is Chemo Patients Take Control.
I'm excited to be here today. It's inspiring to hear about all the incredible progress that's been made over the past 20 years, and I've met some amazing people. It's wonderful to see a sea of purple out there, and I'm feeling, I don't know about you, but I'm feeling inspired and motivated, and it's not even lunch yet. So, 4 years ago, when my partner Rick started chemo, he said it was like drowning in the ocean. I'm not sure how long I can last. Can I make it to the shore? He felt like he had the strength to tread water for a while, but as the waves came crashing in, it then just became about staying afloat. How can I keep my head above water? And just when he would feel like he was about to get a breath, another big wave would crash over him and push him under the water. It was a horrible experience for both of us, one that I wouldn't wish on anybody. But we learned many valuable lessons in that experience, and today I'm going to share 3 of those lessons with you. Rick was when he was first diagnosed, we were thrown for a loop. He wasn't sick. He was running 5 miles a day. He looked good, felt great. And after, we noticed a lump on his neck. And after a routine checkup, the doctor said it was nothing. Well, after a second doctor took a look, we found out that it actually was something. It was cancer, non-Hodgkin's. It's hard to even say, non-Hodgkin's lymphoma. And we've learned a lot about pancreatic cancer from the Hirshberg Foundation and have since come to realize how lucky we were to have a diagnosis where the treatment is actually effective. But needless to say, it was a horrible experience. It was overwhelming. It was scary. Cancer came crashing down into our lives, and we weren't sure we could stay afloat. As Rick's caregiver, I was determined to do everything in my power to help him. I knew that there was something that I could do to help him get through this horrible experience. My background is in research and in data analysis, and so I was pretty confident that if there was an answer, if there was a solution, that I was going to be able to find it. I knew that there was a plethora of resources out there, and so I downloaded every app on the iTunes App Store that had the word cancer or the word chemo in it. I Googled for days. I'm sure many of you have done the same. We got advice from people who had been through it before. But the more time I spent looking for answers and solutions, the more overwhelmed I actually felt, the more confused I felt. I actually felt debilitated. And that's when I learned our first lesson, and that is that every patient is unique. It's just like Dr. Stanton what works for one person doesn't work for the next. There's not a one-size-fit-all solution. Why does this website that I'm reading now completely contradict the website that I was just on before? Then I'd find a great resource, and it seemed to have a lot of great information, but how in the world was I going to remember all of this? So what applies to Rick's situation and what doesn't? And the advice that we got from others, time and again, what Rick personally experienced through his diagnosis procedures and his treatment was nothing like what we'd been advised to expect from those who'd been through it before. Diagnosis might be the same. Many of the treatment options are standard, but there's a multitude of factors that make each patient unique and that influence what they're going to experience when they go through treatment. I loved what we talked about earlier about data mining because I'm a data geek. And all of the focus that's been paid towards electronic medical records and aggregating that and trying to understand what we can learn from that. It goes even beyond that, though. Scientists are exploring genes and biomarkers and trying to discover how and if they should influence treatment and how patients are going to respond to certain medications. What's your support system like? Are you having to go this alone, or do you have a team of family and friends that are holding your hand all the way through? Is your financial situation causing stress to what's already a stressful situation? Where do you live? Are you lucky enough to live in Los Angeles, or do you live somewhere cold where it makes it hard to get outside and to be active? Do you trust your doctor? Do you feel like you can express how you're feeling, or do you feel like you don't want to be a bother? Do you have a high tolerance for pain? Do you believe in God? Is prayer going to get you through? The healthcare industry is just beginning to tap into the ability to understand how all of these factors, and if any of these factors, should influence treatment and care decisions. In my professional life, companies have in the past paid me big money to help them make better decisions using data. So identifying opportunities, reduce risks, how to become more efficient. So I figured I could do the same thing for Rick. You sort of gravitate to what you know in those situations. So I decided to create a system for keeping track of Rick's medications, and while I was at it, I was going to track his experiences and his activities and his encounters in a way that could then be analyzed, and maybe I would learn something from that. So I started asking Rick lots of questions multiple times a day and started mapping everything back to spreadsheets and created great charts. And this system actually turned out to be a game changer for us, and that's what led to our second lesson. It's something that seems to make sense, but it's a secret that a lot of people don't know, and that is that most of the symptoms and the side effects that come from treatment can actually be managed. That means that your doctor, your care team, can often significantly reduce, if not help you to avoid these things altogether. But because every patient is unique, some of those side effect management strategies involve a certain amount of trial and error. And so doctors and nurses and your care team depends on feedback from their patients. And the more timely it is and the more accurate it is, it helps them to manage these side effects and these symptoms more effectively and more efficiently. In our experience, Rick, early on, really struggled with, and he hates it when I say this, he really struggled with constipation. And it was actually debilitating for him to the point where he couldn't eat. He had trouble sleeping. It was painful, so he even had trouble getting around. He felt helpless. But because I was tracking his symptoms and his side effects along with his activities and when he was taking his medications, I noticed that the days that he was experiencing constipation seemed to be happening on the days that he was taking a certain anti-nausea medication. And so the next time we went for our doctor visit, I brought my charts and I pointed to the patterns that I had noticed, and I asked our doctor, could this potentially be what's causing Rick's issue? And that's when we learned our third lesson. Patients and caregivers are not powerless. Our doctor decided to prescribe an alternative nausea medication for Rick. And by the way, there's like 30 different options. We had no idea. So there's options. But that did the trick. Rick's constipation went away, and I did that. I was his caregiver. And I made a difference. And that early win was incredibly empowering for me as Rick's caregiver. We expected negative side effects. I mean, we knew that he was going to be nauseous. And we were resigned to the fact that things were just going to suck for a while. And we were focused on how to deal with the negative side effects, not how to change the negative side effects. That win taught us that we were not powerless. Rick didn't have to just take it. What he did mattered, and what he didn't do sometimes mattered. It had a significant impact. Things that he was doing had a significant impact on how he was feeling and what he was experiencing through chemo. And it wasn't just medication-related activities either. Because I started tracking his water intake, Rick could actually see the benefit of drinking more water. I was creating charts that lined up his physical activity and his exercise activities with how he felt each day. And sometimes I would pat him on the back and say, come on, you're gonna feel better if you just get out and get active a little bit. But that didn't work as well as being able to actually see that feeling better was tied to the days that he was active, and sometimes on the days afterwards. He felt better when he was more physically active. He could see that. As his caregiver, I started recognizing patterns, and so I could actually anticipate his highs and lows, and I could be more proactive and strategic about what I would plan for him. And by the way, our doctor actually loved this system that I had created with my computer and my spreadsheets and my charts, because it actually made our times with him more efficient. When we would come in for our visits, I would have my charts ready and we would point to any issues that we were experiencing. If he had any questions, I could turn the page and point to exactly what was happening and when, and that took about 5 minutes, and we would spend the rest of our minutes just sort of catching up. So it actually turned into a much more efficient interaction. Tracking and analyzing Rick's experiences in my computer and his activities was so beneficial to our experience that we decided to create an app that would help other patients. And we named it Chemo Wave, because although Rick first felt like he was drowning in the ocean, just like surfers learn how to navigate the waves. Like surfers, Rick learned that there were certain points in the wave where you could sort of catch it and it would actually propel you forward instead of crashing down on you and pushing you under. And that's what Chemo Wave did for him. What's exciting is, and Dr. Hines, I think, referenced the study, a month before we launched, the results from a clinical trial were released, a 7-year clinical trial that proved the benefits of patient-reported symptom monitoring. So in this trial, care providers were monitoring the symptoms that patients were tracking from week to week in the computer system so that they could make interventions if necessary. And the results were incredible. We saw a higher quality of life, a reduction in emergency room visits, and these patients actually lived longer and their survival rates were higher. And the patients, they were entering all of this information in a computer system, so it wasn't on a mobile device, sort of like what Chemo Wave is now. They were entering on it, but the patients that indicated that they were technologically challenged actually experienced greater benefits than those that weren't. All that is to say, every patient is unique. There's not a one-size-fits-all solution. Chemo Wave is an app, and our goal is to inform patients, to empower patients, and to help them understand their experience so that they can have more control in their situation, learn how to navigate the waves and catch it at the right spots to propel themselves forward. And when they're sharing that with their doctors can intervene on their behalf and manage the side effects and symptoms more effectively. The other piece of what we're doing, though, is we're amassing a game-changing database of patient experiences. So we talked about electronic health records and how there's been a significant effort to sort of see what we could learn from this aggregated information. And there's also the 95% of what a patient experiences outside of a clinical setting. So our hope is that one day we can supplement this electronic health record data with activity levels and weather and do you own a pet, do you pray, and how all of these things can impact what a patient goes through when they're experiencing their treatment. Thank you, Augie, and the Hirshberg team for all that you've done to continue to empower patients. You have control. You're not powerless. And also for the contributions you've made to research to help to improve diagnoses and outcomes, and also to uncover aspects of the treatment journey that could be improved and make it easier for pancreatic cancer patients. We're all in this together. We're never going to give up. It's an honor to fight with you. Let's continue the momentum, and let's keep pushing forward.